Hello everyone, welcome back to my channel Anytime Medicine, and today we are going to learn about glycogen storage diseases. So before we start, subscribe to my channel Anytime Medicine so you cannot miss my future videos. So we're gonna start off with the basic knowledge of glycogen storage disease. Most are autosomal recessive and there will be impairment of the glycogen breakdown that we have seen before in my previous video. There are main two symptoms related to liver and muscles. In liver, there will be accumulation of glycogen because glycogen breakdown is not working. Therefore, we will see the hypoglycemia in our body. Muscle get energy from the glycogen breakdown. In these diseases, glycogen breakdown is not working, therefore we will see the weakness in the muscles. There are more than 14 described glycogen storage diseases, but we are going to see only 4 in this video. So this is the chart of glycogen breaking down. In this chart, there is most 4 important enzymes. First is debranching enzyme, glycogen phosphorylase, glucose 6-phosphate, and alpha-1,4-glucosidase. These 4 enzymes are related to this video because we are going to see only 4 of the glycogen storage disease, and we are going to see it by step. So before we start looking into the diseases, we will see some questions that are related to glycogen storage diseases. So first question is the 2-month-old child is evaluated for failure to thrive. During the examination, the child has seizures and that serum chemistries demonstrate severe hypoglycemia, hyperlipidemia, lactic acidosis, and ketosis. Physical examination is remarkable for hepatomegaly, a finding confirmed by CT scan, which also reveals the adenomegaly. Which of the following disease best accounts for this presentation that we are going to see after this video? Second question is a 16-year-old boy present with the primary care physician with the complaint of fatigue and muscle cramps. He recently tried out for his high school basketball team and found himself exhausted and unable to run after performing a set of high-intensity sprints. He notes that after seeing briefly, he is able to get a second wind. After practice, he noticed that his urine was brown color. Laboratory results are significant for elevated creatine kinase level of 1423 units per liter. There was no elevation of lactate levels on forearm non-ischemic testing. So we'll see which is the disease afterwards after we review all the diseases. Third question is a 1-year-old boy is brought to the physician by his parents because of the severe hypotonia. The patient's mother states that he had difficulty feeding because of the progressive dyspnea and fatigue. Physical examination shows a liver edge about 5 cm below the right costal margin and wells are ahead of the auscultation of both lower lung fields. A chest X-ray shows cardiomegaly. Deficiency of which following enzyme is most likely to be responsible for the patient's symptoms that we have seen these enzymes in previous chart that we are going to review that what disease is related to these enzymes. So we will see that which answer can be in this one. So the fourth question is that the child presented with the growth retardation and muscle weakness. He was found to have hepatomegaly, hypoglycemia, and accumulation of highly branched glycogen core limit dextrins. So what is the probable answer of this? So we're going to see that in a minute. So the first disease that we are going to discuss about is von Gierke's disease, which is also called glycogen storage disease type 1. In this disease, there will be deficiency of glucose 6-phosphate. This disease occurs in the infancy with a child of 2 to 6 months. In this, there will be severe hypoglycemia between meals, and there will be lethargy, seizures, and lactic acidosis too. There will be enlarged liver because of the excess glycogen accumulation in the liver, and this also can lead to liver failure. So in von Gierke's disease, there will be deficiency of glucose 6-phosphate enzyme, which is only found in liver. So there will be accumulation of glycogen in the liver, and therefore we will see the symptoms of hypoglycemia. But we will not see the symptoms which is related to muscles like weakness because this enzyme cannot be found in muscles. We can do diagnosis by the DNA testing, which is the preferred technique, and there is a historical technique, which is the liver biopsy. In treatment, we will give them cornstarch like glucose polymer. We will avoid the sucrose, lactose, fructose, and galactose because they go into the glycolysis pathway and they cannot do the glycogen breakdown. So it will worsen the effect of the glycogen accumulation in the liver. Next disease that we are going to see is Pompe disease. This is also called glycogen storage disease type 2. And there will be deficiency of acid alpha glucosidase and also lysosomal acid maltase deficiency. There will be accumulation of glycogen in lysosomes, and this classic form presents only in the infant. In severe form of this disease, baby also can die from the illness. So in this glycogen breakdown chart, there will be deficiency of this enzyme, alpha-1,4-glucosidase enzyme, which is only found in lysosomes. So we will not see any type of hypoglycemia or muscle weakness like symptoms in this disease. There will be symptoms like enlarged muscles, especially in heart and the tongue. There will be hypotonia, liver enlargement because of the heart failure, not because of the glycogen accumulation. There will be no metabolic problems like hypoglycemia, and child often get dead from the heart failure. The third disease that we are going to discuss is the Cori disease, which is also called the glycogen storage disease type 3, in which there will be deficiency of debranching enzyme, and because of that there will be minor hypoglycemia, there will be no lactic acidosis, and we are going to see the muscle involvement, and there will be glycogen accumulation in the muscles. So in this disease, there will be gluconeogenesis will be intact. You have to remember that there will be gluconeogenesis intact in this disease because there will be other source of the glucose 6 phosphate for the gluconeogenesis to occur. In this glycogen breaking down chart, there will be deficiency of this debranching enzyme, so they cannot do all this glyconeogenesis process. So they cannot do this glycolysis process in the muscles too. So there will be accumulation of glycogen in the muscles in the Cori disease. So we will not see the symptoms like hypoglycemia, or we will see the symptoms of hypoglycemia very minor because there will be other source of glucose 6 phosphate in the body. Mccardle's disease, which is the last disease that we are going to discuss in this video, which is also called glycogen storage disease type 4. In this disease, there will be deficiency of glycogen phosphorylase. In muscles, there will be especially myophosphorylase deficiency. Skeletal muscles, it has unique form of isoform, which is G-phosphorylase. So glycogen cannot properly broken down in muscle cells, therefore we will see the symptoms of muscles in this disease. Usually present in adolescence and early childhood. Remember that this is the only disease which is occur in only adolescence and childhood. Other disease that we have discussed about which occurs in infancy. So in this disease there will be exercise intolerance, fatigue and cramps. There will be poor endurance, muscle swells, and there will be weakness of muscles. There will be myoglobinuria and creatine kinase release, especially with exercise, and urine may turn dark after exercise. So in this glycogen breaking down chart, there will be deficiency of glycogen phosphorylase, so they cannot do the glycolysis process too in the muscles. So this is the question that we have seen in the starting of this video. So in this question, there are certain key points like failure to thrive, seizures, severe hypoglycemia, lactic acidosis, and hepatomegaly. All this leads to one only enzyme deficiency, which is glucose 6 phosphate enzyme deficiency, which is only found in liver. So this suggests the answer von Gierke's disease. So this is the second question that we have seen before. In this question, remember that I have told you there is only one disease that is occur in adolescence. In this question, there is a 16-year-old boy found himself exhausted and he do high intensity sprints. With high intensity sprints means a high amount of exercise, and his urine turned brown and his creatine kinase is above the roof like 1423. So this suggests only one enzyme deficiency, which is glycogen phosphorylase, and this suggests Mccardins disease. So the third picture that we have seen before was that there is 1-year-old boy who comes with hypotonia, dyspnea, and fatigue. and his liver also shows enlargement. So there is only one enzyme deficiency coming into our mind, is that lysosomal alpha 1 4 glucosidase, and this is Pompe's disease. So the fourth question was this, that there is a child with growth retardation and muscle weakness with hepatomegaly, hypoglycemia, and accumulation of the dextrins in the glycogen. So remember that who break down the dextrins, if that enzyme doesn't break down the dextrins, which means there will be deficiency of that enzyme, and that enzyme is the debranching enzyme. So that means that this disease is Cori's disease. So thank you everyone for watching this video. If you like this video, hit the like button, subscribe to my channel, and share it with your friends. And comment down below that in which topic you want me to make video on. Thank you.